As we progress into the era of the internet, one area that seems to have been mangled up the most is information, or false information to be exact. Especially when it comes to medical and nutrition advice, there's hundreds and thousands of misleading articles, myths, pseudoscience, and the list goes on. As such, this gave birth to much confusion surrounding the right advice. So it begs the question, is there somewhere or someone we can reach out to for the right information, especially when it comes to nutrition? To find out more about that right person and evidence-based dietetics, I spoke to the council members of the Malaysian Dietitians Association, and here's what they have to say.
A dietitian is a qualified allied health profession who assess, diagnose, and treat dietary and nutritional problems at an individual level. We do this using a process called medical nutrition therapy.
So medical nutrition therapy, it encompasses of nutrition care process where we're providing to the patients that derives from evidence that helps to improve patients' nutrition. So what is actually evidence-based dietetics? Evidence-based dietetics is literally looking into the questions, the research gap, information that is required systematically based on the scientific evidence available. Once all this information has been collected, it needs to be systematically put together and appraised. The dietitians would be the best professionals to look into these informations appropriately in order to give the best nutrition advice to the client or the patients.
Traditionally, dietitians work in hospitals, in the government or the private hospitals, making sure or delivering the medical nutrition therapy through diet prescription or even diet consultation. Dietitians work in food services sectors in hospitals, in mass factories, in order that certain dietary needs of the clients are met.
We provide the medical nutrition therapy across the lifespan from womb to tooth. We are not only provide the services to the hospital, but we also involve community, retail pharmacy. We have services helping athletes to increase their performance in Sekolah Sukan and Institute Sukan to our armed force in Hospital Angkatan Tentera Malaysia.
In community care, dietitians can be found in dialysis centres, rehabilitation centres for stroke, centres for children with special learning needs, and even nursing homes. As we move into the 21st century, you can also seek diet consultations with your dietitian through digital health platforms and social media.
Nowadays, there are a lot of individuals who give advice about diet and lifestyle. However, I think it's important for the public to recognize that a qualified dietitian is someone who actually has a degree in dietetics. They have undergone at least a 4 years undergraduate degree, in which they must also do about 1,200 hours of supervised internship. Under the Allied Health Act 2016 or Act 774, dietitians need to be registered with the Ministry of Health in order to practice profession.
So it seems when it comes to nutrition advice, instead of listening to the random person on the street, you may want to find out where your nearest dietitian is at.